Now we are going to discuss about the scalp. At first, we are discussing about the extension of the scalp. Extension of the scalp. Anterior portion, that is supra-orbital margin, posterior, that is external occipital protuberance, and superior nuchal line. And each side or both side of the skull, that is superior temporal line. The supraorbital margin, that is the superior portion of our orbit. If we draw a rough diagram of a skull, that is not so good, but a rough sketch, that is the eye orbit, and the marginal portion is the supraorbital margin. This is the superior portion of the orbit, so the marginal structure is known as supraorbital margin. And simply we can found the posterior portion, that is the external occipital protuberance and superior nuchal line, which is wavy appearance at the occipital bones, and each side means the above portion of our ear. If we draw a ear here in the skull, then this portion roughly you just understand that this portion are the superior temporal line. That is the extension of the skull. Now the discuss about the detail about the skull, that is the layers of the skull, that is SCALP. Means S indicates the skin, C indicates the connective tissue or the superficial fascia, A indicates the epicranial aponeurosis or the gallia aponeurotica, L indicates the loose areolar tissue, and P indicates the pericranium. These are the all layers of the skull. Now we discuss about the skin. In the skin, generally it is thick. You should remember is it just a point, so you can easily remember it. Thick. Number 2 is it's hairy. It's thick and hairy. And number 3, it contains several sweat glands and sebaceous gland.
Yes, sir.
Sebaceous gland. And number 4, it's adherent to the epicranial aponeurosis through the dense superficial fascia. Okay. Now the superficial fascia means the connective tissue. It's a layer of the skins. It's thick, it's hairy, it's several sweat glands and sebaceous glands are found, and it is adherent to the epicranial aponeurosis. It is near to the epicranial aponeurosis through the dense superficial fascia. Dense superficial fascia means here contain many connective tissues. So this is dense connective tissues. So this is dense superficial fascia. Then the superficial fascia or the connective tissue The superficial fascia contain dense connective tissues. Dense connective tissue, and it contain connective tissue. It means contain many blood vessels, and it binds to the skin, to the subjacent aponeurosis. It binds the skin to the subjacent aponeurosis. Here also we found muscles that is known as occipitofrontalis muscles. Occipitofrontalis muscle. The occipitofrontalis muscle contain two bellies. There are two bellies, that is occipital bellies and the frontal belly. Occipital belly and frontal belly. The occipital belly is known as occipitalis, and the frontal belly is known as frontalis. These two bellies are inserted in the epicranial aponeurosis. These two bellies of the occipitofrontalis muscle is insert means joints, inserted into the epicranial aponeurosis. Here are two special points. There are the frontal belly is supplied by the frontal belly is supplied by the temporal branch of the facial nerve. We found that the another portion, that is the nerve supply of the scalp, that is the temporal branch of the facial nerve, and the occipital belly is supplied by the posterior auricular branch of the facial nerve. Here it is supplied by the facial nerve. It is the additional points of the superficial fascia or the connective tissue. We found it after some times. There is the nerve supply of the scalp. Then the epicranial aponeurosis or the gallia aponeurotica. There are gallia aponeurotica. These are the freely movable part on the pericranium. Okay, this is freely movable part of the pericranium, and it is number 1. And number 2, it is adherent and overlying the skin. Okay, and each side it is inserted into the superior temporal line. That is, we first discuss about the superior temporal line, that is the ear part, the superior portion of the ear, that part is the superior temporal line. Just a rough diagram. Inserted or attached with the superior temporal line, both sides. So anteriorly it receives the insertion of frontalis muscles or frontalis muscle, and posteriorly it receives the insertion of occipitalis muscle. Okay, That is, the scalp have three parts. We easily found that the anterior part, the posterior part, and the both sided part. Firstly, when we discuss about the extension, also we discuss the anterior part, posterior part, and the each side or the both side of the skull. That is, the anterior part is the supraorbital margin there, posterior part the external occipital protuberance and the superior nostril line are there, and the each side or the both side of the skull there are superior temporal line are found. In case of the Gallia aponeurotica or the epicranial aponeurosis, it is the largest portion that is overlying to the superior orbital margin to the extension of the the external occipital protuberance. There are also three parts: the anterior part, the posterior part, and the superior and the each side. So anteriorly it is inserted into the frontalis muscle, posteriorly the occipitalis muscle, and each side the superior temporal line. Then the layer loose areolar tissue, loose areolar tissue. Extension, here also the loose areolar tissue extension, its extension anteriorly, eyelids posteriorly, superior nuchal line, and each side. We found that all the portions, their anterior portion, posterior portion, and each side, the both side portion, that is some common relation. That is, anteriorly the eyelids, posteriorly the superior nuchal line, and each side the superior temporal line, the superior temporal line. So it's very easy. That is, some common things are there. And the fifth layer is the pericranium. Pericranium. It is loosely attached to the surface of the bones, but it is firmly adherent to their sutures, where the sutural ligaments binds the pericranium, to the endocranium. Okay. Anteriorly eyelids, superior nuchal line, and the loose areolar tissue at the eyelids, superior nuchal line, and superior temporal line. And here also we found the emissary veins, which is connect the extracranial veins to the intracranial venous sinuses. Here passes the note, that is the emissary veins. Emissary veins are found. Which connect the extracranial cranial vein to the intracranial venous sinuses. Intracranial venous sinuses. Okay, there are the rough diagram, that clear all the things. That is a rough diagram. Here this structure you found previously, that is the glomerulus like structure, Bowman's capsule like structure. So easy to remember it. This layer is hairy. So easily found that this is the skin. So skin is thick and hairy and contain several sebaceous glands or sweat glands. Okay, this is S, short form we mentioned. Then the connective tissue or the superficial fascia, the C. This is a connective tissue, means here contain many blood vessels and dense connective tissue. Then we found the epicranial aponeurosis or gallia aponeurotica. So it is A, epicranial aponeurosis. Then we found the loose areolar tissues. This is L. And then we found the pericranium. All the 5 layers are here. This is skin, this is connective tissue, this is epicranial aponeurosis or gallia aponeurotica, this is loose areolar tissue, and this is pericranium. And then okay, this portion is the skull bone. You find that the suture, okay. Then it is the layer of the dura mater, and the emissary veins are attached here. This is dural venous sinuses. This is the meningeal layer of the dura mater, and this is the endosteal layer or periosteal layer. Layer of dura mater. How the dura mater is formed and how the dural venous sinuses are formed, this will be discussed on the cranial cavity portion. This is our technique that you easily remember how the dura mater is formed, how the meningeal layer and endosteal layer are formed. So now the scalp is the layer, okay, and another portion also the scalp here, the regions, the arterial supply, the blood supply, the nerve supply. it is also discusses in the next video. So thank you guys. If you like this video, so like, share and comment and subscribe my channel also. Thank you so much.